Hello, I'm Dr. Ralph Stockmann, chiropractor, and today we're going to talk about sacroiliac subluxations or sacroiliac sprains. The sacroiliac joint, your sacrum, is the last bone in your spine that your entire spine sits on. It's a triangular bone. So this is your sacrum, and the spine sits on it. Okay. Now, this is your sacroiliac joint. You can see how large it is. It's the biggest joint in your body. It's actually not a proper joint. It's called a syndesmophyte, which is very similar to the sutures in your cranium, in your skull, how they sort of meet together. Now, this bone here, your sacrum, articulates with your ilium. So this is your sacrum, and this is your ilium. So this is called your sacroiliac joint. Your sacroiliac joint is very complex. It has an upper boot and a lower boot, and either one of them can cause problems. Now, sacroiliac subluxations or sprains are a very misunderstood problem in medicine and in the general public. Oftentimes they present with pain in the hip or in the groin. Now, this is referred pain from the sacroiliac. As you can see, the sacroiliac joint, if you go to the opposite side, it's pretty much right into the groin area, which is right here. So pain from your sacrum here radiates into your groin, or also gives you a vague pain in the area of the hip, which can go around into the groin, or it can go down the front of the leg towards the inside of the knee. So just like problems with your disc or lower back cause sciatica, which is pain radiating down the leg, this is referred pain. Your sacrum will radiate pain into the hip or into the groin or down the front of the leg to the knee. So it's not your hip that's causing the pain, it's your sacroiliac. And in the medical profession, this is very misdiagnosed. They'll go and take an x-ray of your hip, and there won't be anything wrong with your hip because your problem is in your lower back. Your sacrum is referring pain into the hip or the groin. So there's no point in treating the hip or the groin. That's not where the problem is. The problem is in the lower back, in the sacroiliac joint. Now, sacroiliac patients present with pain in their lower back, and they'll point right to your little dimple in your lower back on either side. That's where your sacroiliac is. It goes all the way down to your tailbone. And a patient will present with pain in their hip or the groin or their lower back. And what they'll tell you is that it hurts to sit or to get up from the seated position. Now, if you're sitting, your knee should be lower than your bum. If you're sitting on like a dining room chair where your knee is lower and your feet are flat on the floor, then that's proper posture and good for your spine. Most couches and lounges are too low. So if you're sitting down and your knee is higher than your bum, as if you're squatting, then that is very stressful on the sacroiliac joint. Okay? Another way to cause problems with your sacroiliac joint is to sit cross-legged, where you cross your leg at a 45-degree angle to your other leg. So if you sit like a man sits cross-legged or cross-legged on the floor, then this will aggravate your sacroiliac condition. How does your sacroiliac go out of alignment in the first place? Very easily. If you step off the curb and you're not ready for it, or you step in the hole and you're not ready for it, or you stumble. You don't even have to fall. It's what we call that misguided or unguarded motion when you're not ready for it. All you have to really do is stumble to throw out your sacroiliac joint, or another way to do it is to reach over, stooped over far and picking something up, as if you're reaching over a table and picking something up on the other side. That's another common way to cause problems with your sacroiliac joint. Now, this is also an inflammatory condition, so it causes swelling and inflammation in the area. And again, you don't want to use heat on it. It's best to put ice on your sacroiliac joint, which, keep in mind, is quite large, so you need to ice from your lower back all the way down to your tailbone on both sides. And if you use 2 or 3 layers of wet paper towel and then the ice on top, then that will protect you from the frostbite. So icing 20 minutes, 3 to 5 times a day for a sacroiliac problem. And again, I like to treat these in the beginning more conservatively without any rotation type manipulation, using blocks or activator, non-force or low force techniques for the first couple of weeks until the swelling and the inflammation is out of the sacroiliac joint. So these things don't really show up on X-ray or on CAT scans or MRIs unless you have had a sacroiliac problem for a very long time and it becomes arthritic. And this also happens with women. If they've had multiple births, 3 or 4 or 5 children, oftentimes a woman will tell me, well, my back's never been the same since childbirth, and that's because when you give birth, the sacroiliac joint is where your spine hinges in the sacroiliac joint, so this will come together so that this will open up at the pubic bone and give you more space in the birth canal so the head and shoulders can come out more easily. So it is a ligament, and just like if you continually roll your ankle, the ligaments can become loose and sloppy, so they won't maintain the integrity of the sacroiliac joint. In that case, sometimes we have to use a compression belt to actually hold the sacroiliac joints together for a couple of weeks so they can begin to heal. And then we can also use supplementation to increase the strength of the ligaments in the area. And again, we'll use curcumin, anti-inflammatory, to reduce the swelling and the inflammation. Again, I don't find analgesics or pain pills to be very beneficial for this type of problem. So there's a little information about your sacroiliac joint and how it relates to the hip and groin and pain down the front of the leg to the knee. I hope that clears up some misunderstandings about this very misdiagnosed and misunderstood sacroiliac joint. Thank you.